Do you often feel scared to make simple decisions without begging someone for advice, even what to wear or eat? What if you stayed in a tough friendship just because you feared being alone? That's close to what someone with dependent personality disorder, DPD, feels daily. DPD is a mental health condition under Cluster C personality disorders, where people are overly dependent on others. They deeply fear being left alone and feel helpless when on their own. Imagine needing someone's approval before answering a text message, even from a stranger. That's how strong the need for support can feel. It's not just shyness, it's extreme reliance that hurts relationships and self-confidence. Why does someone develop DPD? It's not from one single thing, but a mix of life experiences and biology. Think about a child who grew up in a home where they were punished for trying things alone, like choosing their own clothes or solving a homework problem. Over time, they learn, I can't do anything right unless someone guides me. Another cause might be overprotective parents who always said, let me do that for you, even when the child could do it themselves. Trauma or illness during childhood can also play a role. It's like a plant that never got to stretch toward the sun, always shaded, so it grows weak and leans on anything nearby. Genes might also add a small risk, like having a family history of anxiety or dependent traits. Imagine your friend cancels plans, and suddenly you panic thinking, who will help me if I need something? People with DPD often show signs like needing others to make decisions, fearing abandonment, feeling helpless when alone, and going to extreme lengths to keep support, even tolerating abuse. For example, someone might stay in a job where they're mistreated because they think, if I leave, I'll never find another. They may beg someone to stay friends, even if that person is unkind. They often lack confidence, say, I can't do this alone about small things, and feel crushed by criticism. It's like living with a constant fear of falling and needing someone to always hold your hand. There's no blood test for DPD. A mental health expert talks with the person, asking about their feelings, past, and relationships. To be diagnosed, the dependence must be long-term, not just during a hard time. For example, if someone only acts this way after a recent breakup, it might not be DPD. But if they've always needed someone to make choices for them since teenage years, that fits. Treatment usually includes therapy, especially cognitive behavioral therapy, CBT. CBT helps people ask, can I really not do this alone, or is my fear too loud? Practicing small independent actions, like ordering food alone, gradually builds confidence. In some cases, if anxiety is severe, a doctor may suggest medicine. But therapy is the real key to change. Can DPD be prevented? Not always, but healthy parenting makes a big difference. Imagine teaching a child to tie their shoes. Instead of doing it for them, you say, try it, you can do it. Each small win builds confidence. Letting kids solve problems, make choices, and face small failures safely helps them grow inner strength. Schools can help too, by encouraging teamwork but also independent thinking. For teens and adults, early help for anxiety or low self-esteem can stop dependence from growing too strong. It's like putting support beams in a building before the walls go up. Prevention starts early with support and space to grow. Recent research shows that understanding attachment styles, how we connect to others, helps treat DPD. For example, studies find that people with DPD often have an anxious attachment, meaning they fear losing closeness. New therapy methods focus on building secure relationships in a safe setting, like therapy itself. Some experts are testing app-based CBT tools that guide users through independence exercises daily, like sending a message alone or planning a route to a new place. Also, brain imaging studies are exploring if certain areas linked to fear and decision, making work differently in DPD. While still early, these advances offer hope for more personalized and effective support.